Okay, so you get your blood test results back and you're scrolling through all these different terms, and then you see it, monocytes. And you're probably thinking, what in the world is that? Well, you are definitely not alone. In this explainer, we're going to break it all down. What these things are, what it means if your numbers are a little high or a little low, and most importantly, what to do next.
Right? You've been there. You get your lab results, you're scanning through everything, and you land on monocytes. Maybe there's a little flag next to it. Maybe it's high, maybe it's low, or maybe you're just trying to figure out what you're even looking at. So what exactly is your body trying to tell you with this one little number?
All right, first things first. Before we even get into the numbers and what they mean, let's just figure out what monocytes actually are.
I want you to think of monocytes as the heavy-duty first responders of your immune system. They're actually the largest type of white blood cell you have. So they're born in your bone marrow, and then for a couple of days, they kind of cruise through your bloodstream, acting like scouts. And as soon as they get a signal that there's trouble, an infection, an injury, anything, they rush to the scene, dive into the tissue, and boom, they transform into these super powerful cells called macrophages. Their job is to literally eat up invaders like bacteria and viruses, clear out dead cells, and basically call for backup from the rest of the immune system.
Okay, so now that we know they're the cleanup crew, let's talk numbers. What does a normal monocyte level actually look like on a blood test? This is where we get into the nitty-gritty. So on your results, you're going to see two different numbers. First, there's the absolute count. That's just the straight-up number of them floating around in your blood. Then you've got the relative count, which is basically what percentage of all your white blood cells are monocytes. For most adults, a normal absolute count is going to fall somewhere between 0.09 and 0.6. It's really important to know, though, that your doctor is looking at the big picture, and as we'll see in a second, a count isn't usually considered really high until it creeps a bit above that range.
Now, if your numbers are outside that normal zone, you're going to hear one of two fancy medical terms. Monocytosis, that just means your count is high, usually when the absolute count gets over 0.8 for an adult. On the flip side, you have monocytopenia, which means your count is low. And this one is actually a lot less common. So let's break down what each of these could be signaling.
So let's start with a high monocyte count, or monocytosis. This is the one you're more likely to see, and most of the time is just a sign that your body's cleanup crew is clocked in and working hard.
So let's talk about the most common and least scary reasons first. A spike in your monocytes is often just a sign that your body is doing exactly what it's supposed to do. It's super common to see these levels go up when you're getting over something, like the flu. Your body is just cleaning up the mess from the battle. Same thing goes for healing after a surgery, or even as a response to certain medications. It's temporary.
Now, if that high monocyte count sticks around for a while, it can be a sign of a more chronic, long-term issue. See, monocytes are on the front lines fighting things like tuberculosis or syphilis. They're also really active in autoimmune diseases like lupus or rheumatoid arthritis, where the immune system is kind of stuck in overdrive.
Okay, let's look at the other side of the coin, a low monocyte count, or monocytopenia. Like I said, this is much rarer, but it can tell us something really important about what's going on inside.
So while high counts often mean your immune system is working overtime, low counts can suggest something different. It might mean there's a problem with production, or that the immune system is just exhausted or overwhelmed.
A low count could point to issues with the bone marrow, the factory where these cells are made, which you see in conditions like aplastic anemia. It can also happen when the body is totally overwhelmed by a massive infection like sepsis, or as a side effect from really strong treatments like chemotherapy. And, fun fact, a slight dip can actually be a totally normal thing during pregnancy as the body adjusts.
Okay, now the vast majority of weird monocyte counts are tied to infection and inflammation, but it's important that we touch on the most serious, though again very rare, possibility linked to a high count. Let's be crystal clear about this. This is not a common outcome. Monocytic leukemia, which is a type of blood cancer, is incredibly rare. We're talking about 3 to 5 people out of every 100,000 each year. Context is so important here, and this number really shows why jumping to the worst-case scenario isn't helpful. A doctor would only really start to think about something serious like leukemia if that high monocyte count is showing up with a whole bunch of other specific symptoms. We're talking about a kind of fatigue that just never goes away, getting sick all the time, bruising like crazy, or waking up soaked from night sweats. These are the red flags that, when you see them together with the blood work, mean it's time for an immediate medical check.
So here is the crucial takeaway. An elevated monocyte count on one blood test is not, by itself, a diagnosis of anything scary.
A diagnosis of something like leukemia is a really complex process. It takes a specialist, a hematologist, and usually involves a bone marrow biopsy to get a direct look at the cells.
So, after walking through all of this, from the totally normal stuff to the super rare and serious stuff, let's bring it all back home. What does this all mean for you and your test result?
If there is one thing, just one, that you walk away with today, please let it be this. An abnormal result is a signal. It's not a diagnosis, it's just your body raising a little flag, saying, hey, maybe we should look into this. It's the start of a conversation, not the final word.
So, what's your game plan? Number 1, step away from the search engine. Please resist the urge to diagnose yourself online. Number 2, make that appointment to talk to your doctor. They're going to look at that one number in the context of everything else, your whole health picture. They're the only one who can really tell you what it means for you.
At the end of the day, a blood test is just a tool. It's a way for you and your doctor to listen to what your body is trying to say. So try to look at that number not with fear, but with curiosity. It's the beginning of a conversation that's going to help you understand your own body just a little bit better.